20 to 26 times in the daytime. How many times now in the daytime? She said 3. Wow. 3 times now in the daytime. You were going 5 to 6 times each night. 1 every hour, just about. How many times are you going at night now? 1 time at night. She went from going to have to pee, urgent, frequent, leaky bladder that she had the bladder mesh put in and bladder mesh taken out because of the infection from the bladder mesh and from the surgery and the anesthesia chemicals that stay in the brain to make the brain toxic. There is research that shows that anesthesia chemicals stay in the brain, stay in the kidney, stay in the intestine, stay in the liver, and they cause the body to work slower, weaker, malfunctioning, leading to neurodegenerative conditions. I find these anesthesia chemicals in people's tissues and help remedy them out of people's tissues. I'll get more to that later on or in another video. But her bladder went from 26 to 30 bathroom trips in one 24-hour period every day for more than just a year, more than just a day, more than just a week. It was for several years she had this weak, leaky bladder, overactive bladder, to now, in one round here, she went down, and let me just say the speed of recovery varies from one patient to another. She went down from 26 to 30 times in a 24-hour period to 3 in the day, 1 at night. Humongous difference. Hello, are you one of the millions of people in the world suffering from a movement disorder, a Parkinson's-like disease? Have you been to your doctors, your neurologists, the hospitals, the best physicians, the top specialists in the field for working with Parkinson's-like symptoms and still have had no relief of any of your symptoms? Or maybe your medications, the dopamine type medications, have actually started to help you for a short while, but they're not helping you the way that they used to help you. Or maybe, just maybe, the medications are still working, but you have to use much more of them in order to, meaning more doses throughout the day. And as we go through this video here, you're going to understand some different complications of the nervous system, or causes of complications in the nervous system, which your doctors really should be investigating and finding out why these different malfunctions develop. Because not all functions of the body, or let's just say all malfunctions of the body within a Parkinson's-like condition, are caused by a low dopamine supply. Now you, or a loved one who's diagnosed as Parkinson's case, have you ever had literally a biopsy of specific parts of your brain where they investigated to see exactly how much dopamine production there was in your substantia nigra, or your basal ganglia, or in your cerebellum, or is there dopamine that's inside your frontal lobe? Are they actually taking samples of the retina of your eye, where you actually have dopamine producing cells in the retina of your eye? Or in the sinus area here in the nose, we have what's called the olfactory bulb, which also helps to produce dopamine. Are they taking samples of these tissues and running labs and finding how much dopamine there is in those tissues? So if you can keep contributing to fundraising groups, and you can keep following the doctor's protocols with the medications, but you also can start to take better control of your life. And you can, even if you're doing a physical therapy to try to help yourself and you're following with better diet, you can start to look at other areas of science, and that is in the literature that does report that certain different hidden disease-causing agents can be inside your various tissues of your body, which can and will interfere in A, dopamine production, B, the function of different parts of your nervous system. So these various infections and toxins can exist in many different tissues of your body and in different tissues of your brain that can cause your body to malfunction. My name is Dr. Lonnie Herman, and in this video, like my others, I share about findings in patient examinations. I'll put up some links in this video so you can see next to me. I'll show you the custom thumbnail from some Parkinson's videos that I put up on my YouTube channel. I'll even label in this video of which these video titles are, so you know which ones you can look for when you go through on my YouTube channel to see these different Parkinson's research videos that I put up about patients and their results that they're getting here. In this video, I'm going to be talking about a patient who's 47-year-old female. Maybe she's 48 at this point. This is January 20th of 2018. Maybe at this point she's 48. I'm going to be talking about a part of her progress that she actually started to experience, that she's enjoying after her first unique examination with me, her first unique exam, and after she did her first protocol at home in Canada. She came to my office here where I'm located now in South Florida, and she while she still is suffering with certain symptoms within her Parkinson's-like condition. I say Parkinson's-like because the doctor diagnosed her with Parkinson's disease, yet never found anything in any test that could truly confirm Parkinson's, besides her presentation of being weak in her legs, having to stay some time in her wheelchair, having a very weak voice, slight tremor of the left arm. But also what they couldn't figure out, which we're beginning to figure out, and I'll help you understand parts of your body in this video, but what they couldn't figure out is why she had such a low, severely low blood pressure, like 65/50, very low. You need your blood pressure to be 120/80, 110/70 without blood pressure medications. You need normal regulation of your cardiovascular system, of your blood pressure. Blood pressure has to be equalized, normalized, stabilized, because the brain depends on normal amounts of blood flow with normal levels of oxygen to the brain and proper amount of carbon dioxide removal, or the amount of removal of the carbon dioxide from the brain tissue. We've got to make sure that both of those are taking place, because if and when there is not enough oxygen to brain, the brain can't be strong. It's going to be weak. Your limbs can be weak. Your brain can have seizure-like, not a seizure, but seizure-like kind of activities where it's producing too much or too little of certain brain chemistries, because when it's not breathing appropriately, when it's not getting enough oxygen supply, how is that part of the brain going to function? If it's not getting enough oxygen supply, how is it going to function? Weaker. When it's weaker, what's going to happen to the tissue that part of the brain is going to be able to control? Or what I should say, excuse me, how is that part of the brain that's not getting good enough oxygen supply? Not a stroke. We're not talking about complete loss of oxygen to the tissue, but what if it's just 20%, 10% less oxygen to a certain part of the brain? How is that part of the brain going to be able to control the limb that it's looking to control? Is it going to be a normal movement, or could it be a slight tremor because the brain is not actually able to breathe normally and get that normal arm function to take place for you to experience a normal arm function, or leg strength function, or vocal cord function, or bowel function, or bladder function? This 47, maybe 48-year-old female, she had one of her problems, in addition to such a chronic low blood pressure that they couldn't figure out. She also had dizzy spells, she had fatigue, she had weakness in her legs, weakness in the vocal cords, weakness and tremor of the left arm. She also has an extremely weak bladder, urgent and frequent and leaky bladder. She also, years ago, she had, after 2 natural childbirths and an epidural, she actually had tubal ligation. And then 4 years ago, she had the first of what was to come to be a disaster, a bladder mesh put in. And then shortly after that bladder mesh, she had a second surgery to take out the mesh because they found it was infected. And this was all because she had this leaky, urgent, frequent bladder problem. You might call it overactive bladder. Maybe they're going to call it a weak bladder. Maybe they call it incontinence. Maybe they call it interstitial cystitis as part of that symptom, as part of an interstitial cystitis symptoms or diagnosis. Watch my other videos. I'll put up a couple of links here about the overactive bladder and interstitial cystitis type of condition that I work with, that I'm very successful with. Well, part of what we've got to understand is that infections can cause disease in the body, or malfunction of these different tissues, how the brain controls the tissue in the body. But also, you can have toxins that get into your tissues. Toxins like mercury from a tooth can cause the brain to be diseased. Actually, let's take a break right now and watch a brief black and white video showing how a certain area within Japan all of a sudden noticed devastating seizure-like and Parkinson's-like malfunctions in people's bodies who lived in this fisherman village, and it was all because of mercury poisoning, which can come from the teeth, but this wasn't from the teeth. But let's watch this.
In 1908, Shin Nippon Chiso built a factory in Minamata, a small fishing village in Kumamoto, Kyushu. The company manufactured nitrogenous fertilizers and soon became the major industry in Minamata. By the mid-1950s, Shin Nippon Chiso had become the industry leader in its field. In 1954, the Sanitation Office of Minamata City began receiving reports of an unknown epilepsy-like affliction which has since become known as Minamata disease. Since the cause of the disease had not been identified, patients were isolated to prevent spread of the disease. Minamata disease is a neurological condition. Mercury poisons the central nervous system, damages the sense of balance and motor skills, which leads to increasingly intense body convulsions and ultimately death. In 1957, the Minamata Disease Research Group of Kumamoto University announced that Minamata disease is a toxic disorder of the central nervous system caused by certain organic mercury compounds transmitted through the intake of seafood. They isolated organic mercury as the sole cause through a series of experiments on cats. In the same year, extremely toxic levels of organic mercury were detected in the human patients. The report submitted to the Ministry of Health and Welfare stated that the underlying cause was organic mercury in seafood, and the wastewater discharge from the factory was suspected. Afflicted patients continued to be found until 1960. A rash of babies were born with brain damage and extreme physical disabilities. The governor of Kumamoto requested a voluntary ban on catches of seafood from the bay.
Okay, you see the devastating effects that happened to these people's bodies from the mercury poisoning that was from the fish, from the poisoning in the water. Well, there is a lot of proof that the mercury in the teeth can actually leach into parts of the brain and the body. I'll put up a couple of articles here so you can look at those online when you get a chance to prove more of the point that I'm making here. She also, had one root canal in her mouth, and that was done a few years prior to this whole disorder starting. And root canals are also a part of the problem. Root canals are infected teeth. They're dead teeth in a living body, and these infections can travel from the tooth right through these blood vessels. Let me show you this image here. You have blood vessels in the teeth that can go right to the carotid and go up to the brain, into the brain stem, and cause the brain to not function well. If you have ever had in your life a sore throat caused by, let's say, a strep throat or strep bacteria in your throat, you couldn't swallow normally, it hurt. Well, how is your brain going to function normally if there's infections from a tooth going into part of your brain or your brainstem, and that part of the brain and brainstem is supposed to be able to control the normal limb movement or kidney function or bowel function or blood pressure function? How is it going to work when it's infected? It can't. Just like you can't swallow normally, you have a malfunction with your abilities to swallow when you have a sore throat, a swollen throat. When you get rid of that infection or decrease the swelling by trying to get rid of that infection, you're going to see you could swallow normally again, right? Simple. What happens when the part of the brain is infected and that part of the brain is supposed to control your limb? When it's supposed to produce dopamine levels at normal amounts, how's it going to do it when it's infected? It just can't. Simple. It's got to make sense to you when I describe it that way. It should hopefully make sense to you describing it that way. Well, when we had a recent discussion recently before she's coming in for her next visit, which is I think in the first week or last week in January, first week in February, when we spoke on the phone, she and her husband had a brief discussion with me because she was concerned because her tremor is the same, Her voice is still weak. Her legs are still weak. Her blood pressure is looking a little bit better, but her constipation remains. And the thing is that her doctor, her neurologist up there where she lives, told her she's got to start weaning off of the dopamine medication. And this patient is starting to feel, she thinks that she's feeling worse because of the dopamine medication decrease. And I asked her this question: were you ever getting better with the dopamine support? She said, no, but I feel like I'm getting weaker. And I'll tell you why in just a minute. And I said, well, let me ask you, the arm is the same? Yes. The legs are the same weakness? Yes. The voice is still the same weakness? How's the blood pressure? Well, now, yesterday, my blood pressure, again, when I told you 65/50 when we first consulted, she had, the day before our discussion, her blood pressure was 101/68. The day before that, 75/49. The day of the discussion was 80/53. None of those are perfect. 101/68 was much better than it was prior. None perfect, but moving up in the right direction. Moving up in the right direction after this initial care program that you started with me, this initial protocol. My next question was, how is your bladder urgency and frequency? And her comment was, well, now the whole mood in the conversation changed. Wow, Dr. Herman, I feel that I'm really better. I'm so pleased about that. Really, tell me more. Because you were going 20 to 26 times. You had to go to the bathroom 20 to 26 times in the daytime. How many times now in the daytime? She said 3. Wow. 3 times now in the daytime. You were going 5 to 6 times each night. 1 every hour, just about. How many times are you going at night now? 1 time at night. She went from going to have to pee, urgent, frequent, leaky bladder that she had the bladder mesh put in and bladder mesh taken out because of the infection from that bladder mesh and from the surgery and the anesthesia chemicals that stay in the brain to make the brain toxic. There is research that shows that anesthesia chemicals stay in the brain, stay in the kidney, stay in the intestine, stay in the liver, and they cause the body to work slower, weaker, malfunctioning, leading to neurodegenerative conditions. I find these anesthesia chemicals in people's tissues and help remedy them out of people's tissues. I'll get more to that later on or another video. But her bladder went from 26 to 30 bathroom trips in one 24-hour period every day for more than just a year, more than just a day, more than just a week. It was for several years she had this weak, leaky bladder, overactive bladder, to now, in one round here, she went down, and let me just say the speed of recovery varies from one patient to another. She went down from 26 to 30 times in a 24-hour period to 3 in the day, 1 at night. Humongous difference. I found with her in the first examination, I found that a tissue, which you haven't heard me talk about in my other videos, but let's put this image up here now, the corpus callosum. Corpus callosum are over 200 million nerve fibers. I don't know if you've ever seen a spaghetti squash. When you open it, I'll put up a picture of a spaghetti squash here. Open it, you see all these fibers of spaghetti-looking squash fibers in this spaghetti, in the squash. In the brain, if we took the brain like this and opened it up underneath, when we look inside, when we pull these two hemispheres, right and left hemisphere apart, we're going to see over 200 million nerve fibers that are connecting all different regions of the brain, regions that are for vision, regions for memory, regions for cognitive function, for smell, for peripheral vision, for movements of the body. There's actually dopamine that has to travel across these corpus callosum nerve fibers. Serotonin does, and other brain chemistries like acetylcholine, epinephrine, norepinephrine, and GABA, anti-anxiety, anti-depression, good mood, not jerky, interrupted, or involuntary movements, because of the corpus callosum has to be functioning well, as well as blood pressure regulation. Sensory and motor controls are in great part regulated by this corpus callosum tissue. In her corpus callosum, I found residues of the thimerosal, mercury that was in vaccines when she was a child. Those were in her corpus callosum. Remember back to what I just showed you earlier on in that black and white video, Minamata disease, jerky, seizure-like tremoring, uncontrollable involuntary movements with the body. Mercury poisoning did it. Thimerosal in her corpus callosum, interfering with the flow of the dopamine through different tissues, interfering with the function of how right brain and left brain are going to communicate, interfering with how the brain can tell the body parts how to work. I found in her upper brainstem, I'll put an image up here next to me, the upper brainstem, also known as the mesencephalon. Mesencephalon, also known as upper brainstem, also known as the midbrain. I found thimerosal mercury there. Residues of antibiotic. I found Lyme infection, parasitic infection, Mycoplasma bacteria. I found group B streptococcus bacteria in her mesencephalon, all causing autonomic nervous system malfunction. I found in the pons of her brainstem, right next to me, you see that image, the pons, which has, by the way, the pons has what's called the micturition center, also known as the urine reflex center. I found in the pons dengue fever, Candida albicans, Lyme infection, residues of Coca-Cola, and Candida krusei. That was in there. That pons can't regulate body parts when it's so infected and toxic. I found inside the pons, there's an area, and inside the whole brainstem for that matter, there's what's called the reticular formation. Let's take a look at what that looks like. The reticular formation is a very complex web of nerve tissue nuclei that help to regulate parts of the body, including speech, including strength of limbs, including our organs to digest and heart rate and swallowing and breathing and bladder control and intestinal control and limb movements. There's so much brain function that has to go through this reticular formation tissue, as well as the reticular formation is like the lighter that lights the wick on the firework to make the firework go up to the sky, to be able to control, to have a beautiful firework display. Well, the reticular formation lights up what's called the thalamus, and the thalamus sends signals up to the upper motor neurons in the cortex of the brain for the brain to be able to control the body. Okay? Well, her reticular formation, Lyme infection in there. Mercury dimethyl methylchloride. How she got it, maybe it's from seafood, maybe it's from her vaccine, maybe it's from her parents, maybe it's, I don't know where she got it. Parasitic amoebas in her reticular formation also, needing supportive remedies for capillaries and arteries and veins to get more oxygen in, carbon dioxide out of that reticular formation, because it's not just infection and toxin that can cause the body to malfunction, but like I said earlier, not good enough oxygen supply to the tissue. We've got to make sure that we can get those blood vessels to do it. And it's not just loss of blood flow through a blood vessel because of cholesterol plaquing on the artery. There's many reasons why the blood flow won't be good enough to brain tissue. And again, parts of the brain regulate, which I may have said this, excuse me, but parts of the brain regulate kidney function, and the kidneys are part of the control of regulating blood pressure. The kidneys have to keep enough fluid in the body to regulate the artery tension or pressure on the artery, so the blood flow goes up to brain with normal blood pressure. The brain is able to sense that, and the brain is able to now tell the kidney when to release or not to release the fluid. When we can get the brain to get back online and sense what the blood pressure is like, and now that brain can regulate the kidney function better, that kidney doesn't have to keep evacuating, releasing the fluid out to the bladder and out the body. The kidneys are not controlling bladder function. The kidneys are not controlling fluid removal. The kidneys are told what to do by parts of the brain. And when those parts of the brain are not regulating the specific hormone called antidiuretic hormone, ADH, antidiuretic hormone is the hormone made by a part of the brain called the hypothalamus. And this part of the brain tells your kidney, stop releasing the fluid. What happens when the hypothalamus is numb to its environment and can't read how much blood pressure there is or what the blood pressure is in the brain? What happens when it can't sense that? How is it going to regulate the hormone from that part of the brain to the kidney? It's not going to regulate it properly. If we have less than normal antidiuretic hormone coming from the hypothalamus down to the kidney, how's the kidney going to know what to do? It doesn't. If we have less than normal ADH or antidiuretic hormone from the hypothalamus to the kidney, less than normal, the kidney is just going to keep releasing fluid. Doesn't know what to do. I also found from a root canal tooth in her mouth radiating infection of candida to the reticular formation. Further, I found from a mercury-filled tooth radiating mercury up to the pons of her brainstem. I also found in the pons malathion insecticide causing it to malfunction, and other tissues in her brain and brainstem that regulate body blood pressure control, kidney function, bladder control, found that they needed extra supportive remedies to make sure more oxygen in, carbon dioxide out, and lymph support. She already, let me repeat, she has, after years of suffering with a overactive bladder, weak, leaky bladder, she now has bladder control. We're in the right process. You can't, well, not can't, let me say this, but most likely people with a Parkinson's-like condition or people with an overactive bladder also have other symptoms going on. So we have to understand that there are other types of body parts that we may have to work with to clean them up so that they also can get back on board. You can't have the orchestra playing where the people with the horns are sleeping and the people with the violins are sleeping and you expect somebody just to play the drums. There's no orchestra. You have to have everybody on board to make a beautiful harmony, symphony, orchestra. You've got to have all that in order. Everybody's going to be on gear. When your body parts and parts of your brain are toxic, they're infected, they're stressed, they're weak, even from, and I haven't talked much in this video about, the LED, high blue light, LED lights from the phones, from the computers, from the tablets, and energy saver light bulbs and flat screen TVs. Researchers have found that they're actually causing damage to the energy production in the cells, and I have a very unique way of examining if the LED lights are actually damaging your tissues and decreasing the function of the cells that regulate dopamine production. Are your neurologists doing that for you? When these different disease-causing agents, also known as pernicious agents, are robbing your bodies and your brain's ability to function normally, you've got to find the causes and remove them. You've got to find the individual hidden disease-causing agents and safely and effectively remove them. That doesn't mean you can't use your cell phone again, but that means we have to find where in the brain and provide the proper remedies for the tissues in the brain and the body that are weakened by the cell phone, weakened by the LED lights, weakened by the infections, and safely and effectively provide the remedies that are going to help them get stronger. Let me quote something from Albert Einstein. He says here, "Everything is energy, and that is all there is to it. Match the frequency of the reality you want, and you cannot help but get that reality. It can be no other way. This is not philosophy. This is physics." Share this video with a loved one. Share this video. Just press on your phone, share, click, real simple. You just pick up your phone and press the button. Simple. Press it. Share it with a loved one. People deserve to hear this. There are results, positive results, that you can get by removing the causes of disease and repairing the body and the brain. Like me on my Facebook page. Follow me on my Instagram. I'm here to help you get well. That is the #1 driving force behind why I do my work, to help you get well. Subscribe on my YouTube channel. You'll be the first to know when I put up new videos. And there are a lot of videos. Scroll through. I've got over 200 videos at this point. Watch other testimonials. Watch other videos. Watch the other Parkinson's videos. I'll have them linked underneath here in this video. Watch the other interstitial cystitis or erector bladder videos that I put up. I'll have those linked underneath too. You can find a way to get well. I'm here to help you do it. Call my clinic, 954-370-3100. That's 954-370-3100 when you're ready to get well. You can even email my assistant through the email address. I'll put this up on the screen as well. Call my number, email the office. Just know this, my assistant, she's very friendly, she's very nice, she's happy to help you. She doesn't have all the answers of how I'm exactly doing what I'm doing. She can help you make an appointment, help you with where there's a hotel place to stay. People come in from my office from all around the world, from Thailand, New Zealand, China, Russia, United Kingdom, Italy, Venezuela, Mexico, United Kingdom, Canada, other parts of the U.S., people coming in from all around from this work. Your insurance, unfortunately, does not recognize the type of work that I offer. They are not going to pay because there's nothing I can bill them for because my services are not recognized by any of the insurance plans. This type of work I'm offering is your investment in yourself. I understand we all want our insurance to cover everything, but the insurance policies are not covering the type of service I offer. So understand that it is an out-of-pocket investment in yourself for you to help yourself repair yourself and get better function. Speed of recovery varies from one to another. Call my number, 954-370-3100. I'm here to help you get well. I'm here to work with you and help you get the job done. I look forward to helping you.